Psychology is Weird, Post-Traumatic Stress Disorder, a literature review created by me, Zoe Mitchell. So here's my little table of contents, basic overview on what I'm doing. PTSD, post-traumatic stress disorder, is a disorder which may result when an individual experiences, lives through, witnesses an event in which they believe that there is a threat to their life, physical integrity, and or safety while experiencing fear, terror, or helplessness. Thank you to the APA, American Psychological Association. What does it mean to be weird? It means to be Western, to be educated, to be industrialized, to be rich, and be democratic. The weird findings. To our left, we have our participants. We have their gender, their race, their employment, and their marital status. The aim of the study was to explore the lifetime prevalence of PTSD among people on probation who also have other serious mental illnesses and their demographic characteristics. The individuals on probation in 6 counties and 1 southeastern state who had been diagnosed with severe mental illnesses were assessed for PTSD. The study was conducted in 1 U.S. state, North Carolina, and data was collected from 2017 to 2019. So, to the left, we have our results. We have the events that were considered traumatic. We have our non-interpersonal events. We have our interpersonal events. We have whether those met the criteria for PTSD and whether they did not. The study used baseline data from a randomized controlled trial with people with SMI, severe mental illness, who were offered specialty mental health probation arrangements. The screening tool was a 4-item self-report questionnaire that all probationers completed as a part of the state screening for mental illness. The participants were asked to identify experiences with delusions, hallucinations, and severe depressive mood, and the Lifetime Events Checklist, LEC, was administered to each participant to identify exposure to interpersonal and non-interpersonal traumatic events. The non-weird findings. To our left, we have our participants. We have their age, we have their gender, we have their ethnicity, and we have their education. So, the study focused on the trauma and its effects for individuals with SMI and their caregivers in rural Ethiopia. The study aimed to identify events that were considered traumatic by stakeholders, characterizing the mental health effects of such events. Traumatic events and ensuing stress are not widely studied in these individuals with SMI, despite their increased vulnerability to both. And all study participants were recruited from November 2017 to May 2018. The results to the left, we have what were considered traumatic events and how many people actually went through these traumatic events. Qualitative interviews were gathered from 48 total participants in Ethiopia, who included individuals with SMI, their caregivers, healthcare providers, community, and religious leaders. The local understanding of traumatic events and PTSD, along with local presentations of symptoms following trauma and PTSD symptoms, were looked at to see if the public understood what this was. The trauma particular to SMI patients was looked at, along with the pathways or interactions between trauma, PTSD, and people with severe mental illness, given their focus. And the interviews were focused on understanding participants' own lived experiences, including identifying events that they perceived as being potentially traumatic. Data analysis and comparison. That's going to be a quick one. So, our non-weird data compared to our weird data. So, first of all, what was considered a traumatic event for people in North Carolina versus Ethiopia. How many people experienced these events, North Carolina compared to Ethiopia? Along with, whether they had severe mental illness going into it. So, these people were screened because they already had it, and they were looking to see if they had more along with PTSD. While in Ethiopia, they were just looking at these people with severe mental illness to see if this did, in fact, lead to PTSD. Comparison and conclusion. So, the effect of severe mental illness on trauma is consistent across both samples and definitely across the data. You can very well see it, regardless of how the numbers fluctuate. It's very important because it shows that, regardless of whether it's a weird or non-weird study, this should be looked into further and should definitely be looked into very specifically how trauma leads to PTSD and whether this is a consistent thing within all cases. And it varies on all dimensions. So we have Western, we have education, we have industrialization, we have rich, but it does not actually vary on the democratic one due to, no big major impact. The reasoning for this is because, Western, geographical location, education, education was not a big thing in Ethiopia, as you saw with the data. Industrialization, Ethiopia is rural, and North Carolina is definitely not. And the rich variable, economic standing of the U.S. compared to Ethiopia, along with the fact that Ethiopia relies on agriculture, but North Carolina definitely revolves on tourism. So overall, the methods of the study were done differently based on, how they're recorded, but both use the Life Events Checklist and the DSM-5 as criteria for identifying PTSD and other forms of mental illness. And pretty much in conclusion, while the weird and non-weird samples differ, they both showed that severe mental illness can be majorly affected by traumatic events potentially causing PTSD, regardless of whether it's a weird or non-weird sample. Thank you, and that is my presentation.